The most common cause of death is heart disease. The second most common cause of death is cancer. The most deadly forms of cancer are, in order, lungs with 1.76 million annual deaths, colon with 860,000 deaths, stomach with 783,000, liver with 782,000, and breast cancer with 627 deaths globally. So if heart disease is so common, being the leading cause of death, and the second most common cause of death is cancer, then why doesn't anyone die from heart cancer? The answer is actually a lot simpler than you think. As we've discussed in this video on why tall people are more likely to get cancer, the disease arises when cells duplicate erroneously. The more often an organ's cell divides, the greater the likelihood of a bad duplication, and thus, the greater the likelihood of cancer developing. The biggest difference between the heart and all the cancer-developing organs is the speed of cellular duplication. You'll notice on the list that the colon, stomach, and liver are the second through the fourth most common forms of deadly cancer. That's because those three organs are notorious for rapidly going through cellular replacement. On the other hand, the heart is a muscle the size of your fist, and muscle fibers don't divide. You have the same amount of muscle fibers right now as you did when you were a baby, and you will have the same amount when you're on your deathbed. But this begs a question. If organs with cells that don't divide don't develop cancer, and the neurons in your brain can't divide, then how does brain cancer occur? It's true that neurons in your brain will never divide. But neurons aren't the cause of brain cancer. While neurons can't divide, the other cells in the brain can, such as the glial cells. The glial cells support and surround the brain's neurons. And when a person's glial cells duplicate incorrectly, they develop what's known as glioma, which is the most common form of brain tumor, accounting for around 33% of all brain tumors.